Star Outcomes. You have been very busy. The events team will be reaching out shortly so you can get your swag. On with the show. Please welcome to the screen Roy Jacobs from Philips and Slavia Trankova from The Economist. Take it away, folks.
Hello from London. I'm pleased to be here with Roy Jacobs, who is going to talk to us about connected health, telemedicine, and AI, and what Philips is doing in that space. Roy, can we start with could you tell us what is connected care? And then perhaps walk us through your business model and what you do, how it's changing the way healthcare is delivered.
Thank you, Slavia, and a warm welcome from Amsterdam. Connected Care is part of the Philips Group, in which we have therapeutic care, patient monitoring and analytics, sleep and respiratory care, and healthcare informatics. And what we look out for is how we support patients, clinicians, and the health system at large to actually connect devices, data, and systems to provide better patient outcomes and healthcare outcomes. And we do that on a global scale. It's a multi-billion-dollar business unit, and we have reach into many different countries and many health systems and hospitals that we serve.
And what is the scale of this business line? Can you give us a sense of the revenues, the customers, just the growth in these metrics?
Yeah, so the connected care business is approximately 5 billion business. So we are growing nicely. This year is a special year as we have life-saving equipment in ventilation and monitoring that is in very big demand, especially given the COVID circumstances. So we are stepping up to really support whole society in these difficult times. So that has been giving double-digit growth momentum in connected care. And at the same time, we see also a huge surge in the connected informatics space. So the need to integrate data, to have telehealth solutions that we provide, for example, in a tele-ICU environment or connecting into the home, providing wearables is something that is really in significant demand and that we provide new innovations for.
Right. And you mentioned you offer the range of telehealth products from remote patient monitoring to connecting things in ICUs. How have these things played a role in the current pandemic? What has changed?
Yeah, I think the pandemic has been given a specific nature of how care could be provided, has given a significant boost to how telehealth and telemedicine is being applied. And if I just walk you through what a patient would go through. So first, if you would be at home, you need to get first information or screens. We could provide you with questionnaires specifically developed for COVID to assess whether you have the symptoms and you need to be called into a care setting. If you would be in a more urgent state and need an ambulance to pick you up, we actually would, from the ambulance, provide a direct data stream into the hospital to make sure that when you arrive at the emergency room, actually you will be picked up with already your vital signs measured and knowing who you are. Then when you would arrive there, we would provide you with a sensor so that actually throughout the hospital journey, we keep on monitoring the vital signs to also have quick interventions if needed. You would arrive to the ICU where we have a ventilator that, if in need, would be put to you to support you. And we have our monitoring service that actually watches over you on your vital signs in the most critical area of the ICU. And then when you would hopefully recover soon, we would also be able to, on your way back to home, provide you with another sensor that would take care of 30 days after discharge and monitor how you recover, and if need be, actually provide the clinicians the information to call you back or to check up on you.
And are clinicians comfortable with that? I mean, it just sounds like you're taking things, out of their hands in a way. So presumably they'd be nervous that something, is going to fall through the systems. How have you approached getting health systems and clinicians comfortable with the idea?
Yeah, I think we have been working extremely closely with the health system during these times, and we have seen huge breakthroughs in uptake of these new solutions. So I can give you an example of Intermountain, which is a very big health system in the US that were having around 900 telehealth consults before pandemic. They went to 9,000 during pandemic, and actually they're sustaining that as we speak. Another big customer that we serve, Northwell in New York, had to go through a huge increase of capacity. They, in 90 days, implemented that. They had a system that they had been working on for 6 years. So we see that the adoption, given the need that you need actually care at any point in time, but also you need to disconnect an essential patient from care providers and caregivers, given the nature of the disease. Actually, the adoption rate was very high. And at the same time, also to integrate data along that journey has been proven really more effective to support with the huge influx and capacity that actually came to the hospitals. So we have seen the uptake and therefore also the adoption of new behaviors really taking place. We gave them also a lot of educational support. We gave them remote support and on-site support so that actually they felt comfortable in using technology. And I think what is also important is that it's always in support of what the clinician or the nurse has to do. We will not take over their role, but we will give them better information where and when they need it, whether it's on the ICU, on the general ward, in an ambulance, or even when they would monitor home settings.
What about patients? I mean, normally, like, wouldn't they fear misdiagnosis just because it's done, over remotely? The doctor that is not there to touch them, to see them in person. How do you deal with those fears?
Yeah, I think also their pandemic actually has helped to overcome some of those, I would say, behavioral elements that stop maybe people of using it before or trusting it. I think what is important that you make the ease of use very good for a patient. Secondly, that you are very clear on the security of data that you provide, and we put a lot of effort into that. And as well, that actually the patient didn't have the need, and actually they had the ask to be remotely monitored. They wanted to have also a distant and very quick directed connection to their clinician or to their nurse. So they were providing a demand that we could fulfill in with new technology. So actually it was not something that was pushed to them. They saw the benefits. They saw also how it worked. And by reassurance with the clinicians and the hospital system, you see really that will be something that we believe will be sustained and actually will grow towards the future further.
Right. But we are seeing now that patients are actually going back to their offices. So use of telemedicine visits is actually declining. How are you preparing to deal with that?
Now, actually, what we do see is that some of these, and I used the metrics of Intermountain, actually we have seen that, yes, they went to a peak of 10,000, but it actually is now continuing on 9,000 a month versus a level of 900 before. So actually, we see that people stick to current practices and behavior. Secondly, they have seen also what it can do for them and what the benefits are. And it doesn't mean that it will replace doctor visits. Also important is to understand that telehealth is much more than just a Skype call with your doctor. The most important value of telehealth is actually integrating the data of a patient, providing that to the different caregivers in their care settings, so that also we get more accurate. I think still many people might not know that misdiagnosis, so medical errors, are the third cause of death in the US. Now, if we can help by providing better data and continuous monitoring, better support to these doctors and nurses, and therefore bring that level of that down, would be a great impact that we strive for.
Data brings me actually to the use of AI. Can we talk a little bit about that? How do your products use artificial intelligence to help with decisions, workflows, or anything really that happens in a doctor's office or in a hospital?
Yeah, I think if you look to the current trend, I think important is that we quantify more of the patient during his journey. So that is actually connecting data points. But most importantly is that we can qualify the data so that actually we make it into actionable insights that help better treatment. That's where AI comes in to, based upon machine learning and the power of computing nowadays, really use all the data available to get to more accurate recommendations. Of course, they need to be clinically validated. So everything that we need to do and to provide needs to be clinically tested. It is regulated as well with regulatory bodies, and we need to provide it in a secure way. But if you give better insights towards the system, actually they can process it in a better way.
And are doctors comfortable with that? I mean, using AI tools is not something that is really taught in medical school. So what do you do about that? How do you get doctors on board and comfortable using?
So I think very fair comment. I think first of all, AI is an enabler. It's a tool that helps us to give better service. So what a doctor will always judge us on is what is the accuracy level of a measurement that we will give, and he will have clinical reports proving that. He will look at the alarming accuracy. He will look at the predictive power of how we use the data. So they have reassurance also by the clinical testing and validation that actually what the IA provides is what they can build further treatment path and recommendation on.
Okay. Now, one more question on AI before I move on to a couple of other topics. There have been cases where revealing the gender, racial, or socioeconomic biases of AI systems. We've seen various studies in healthcare where biases can have a serious impact on health outcomes. We know that from anything, on racial disparities. How can these biases be avoided?
I think that is where, again, the accuracy of the system and the training of the system, because AI is comparable to data processing that we did as humans all the time and have been doing all the time. It's just computer aided. So you need to train and validate that algorithm in a very profound way. And therefore, the checks and balances that you need to build in and that we have built in, and before you release anything, is really important. That is done by ourselves. That will be done together with the clinicians that we will work with, where we co-develop and test. It will also be regulated. And as I said, we take the high security standards because you also need to make sure that the data are accessible by the right people, and that you make sure it's for the right purpose.
Right. Now let's talk a little bit about one of the main problems that has plagued telemedicine for decades, which is really that data systems don't talk to each other, which I think it's called interoperability
Yes.
problem. Has anything changed in that in recent years, and has anything changed because of the pandemic?
Yeah, I think so. First of all, you call out a very important pain point and also opportunity to improve the data flow on. So interoperability is fundamental. A second point which actually helped tremendously during the pandemic was by making applications cloud-based, so that actually you make sure that you can operate data independent from location and actually provide them where and whenever a doctor would need it. I think that has been taking a huge surge. And if you look to some of the applications that we have, like a Tazi or a TeleICU application that actually is cloud-based and therefore provide a doctor at the fingertips, whether he's in the hospital or in an ambulance or at home, with the right information on the patient, has been providing the right solution. So I think that has been a breakthrough in closed applications to open, making sure that actually you are interoperable to all the systems that exist, and that you make it cloud-based, so that actually it becomes a much more free-flowing environment of data.
Now, Let's talk a little bit more about electronic health records. They were expected to deliver huge administrative savings, save doctors' times. Lots of hopes were placed on them. However, studies and many experts agree that the adoption of electronic health records hasn't really been driving significant cost savings. Where do you think the challenges are in that space? What needs to change?
Yeah, so I think in the application, it's important to not only think of the electronic record as a single point, but actually you need to turn it into a system of engagement that clinicians get access to data in a much wider form. So actually you connect various data points, not only the electronic health records as they are stored, but also to other units and data providers, so that as you give an integrated view. So that is what we call a system of engagement, where you unite the data out of devices, out of the health record, and actually then you make it a management system that people for operational workflow or for clinical workflow optimization can draw from. And again, we saw in the COVID times that it was so important that you could help scale capacity by becoming more efficient in your workflow. Take an example on the tele-ICU application. So if you have a normal situation in a hospital, you would have in an ICU monitor, a ventilator, patient strongly correlated in one bed and a nurse watching over them. But actually with the influx of many, many people at ICU, you need to have a monitoring system across all patients that can direct in the most efficient way the nurse and doctor capacity. And that's actually where you see that if you have an engagement system that can connect the alarming, the data on the patient, the clinical interpretation, and then help to support the capacity, that really helped us to alleviate some of the burden of the health system. And that's where you see now enormous uptake, not only during pandemic, but also after, because people have seen how it helps them become more effective and efficient. And through doing that, actually saving lives, because the sooner you can be, the more accurate you can be in being at the right patient at the right time, really makes a difference between life and death.
What about the privacy and security concerns? I mean, these are topics that cut across anything really, telehealth, AI, any information that flows between consumers, doctors, hospitals.
Yeah, I think it's an extremely important area. We take it very, very serious. Actually, as Philips, we are the first medtech company that got a global certification for our security standards on our SDP, which is our health record system that we have developed as Philips. We know that health data are very valuable, most importantly to the system, but unfortunately not only to the people that use it, also others. So we need to have the highest level of security around it. That also means that in your application area, you need to build that in. And we make sure that any data that we process are within that system that is protected to the strongest measures.
Now, can you share some examples, perhaps on what is the return on investment that's driven from the technologies that you provide to hospitals, just to give us a sense of the business side of things?
Yeah, so I was talking about the tele-ICU application, where you can really manage capacity better on an ICU floor. So we have been implementing that in a US customer, the Avera eCare system, which serves around 30% of US critical access hospitals. By doing so, they could become much more efficient in their operations. So they saved 62 million a year on their operational cost. They saved 11,000 beds of stay. Now that's a huge capacity increase that you can give back to the system. And by doing a better accurate measurement, they also saved 260 lives. So that's an example of, if you apply this in an appropriate manner, that there are huge savings for people, for patients, for the nurse capacity, as well for the system.
I'm looking here at a couple of questions from the audience. So one question is, where are you headed next? Are you interested in acquiring new technologies?
Yeah, I think what you have seen us do also during the pandemic is take wearables. So wearables got a huge surge of need during the pandemic because people wanted to measure patients on distance. So actually, we partnered with BioIntelliSense for a wearable sensor. So I think we look at driving innovation in healthcare as an ecosystem play. So we cannot do all the innovations ourselves. So we will also look at partners to do it with us. So BioIntelliSense on wearables was a good example. We also had our own wearable. We were also working with Amwell on telehealth. So how we can actually provide the infrastructure into homes. So we will work with different parties to provide the services that hospitals or caregivers needs.
Another question from the audience. What do you consider most critical to your approach to innovation beyond the use of new technology?
So we think we have, so our mission is improving people's lives. But when we look at kind of where we want to direct our innovation to, we look at what we call the quadruple aim. Now, in the quadruple aim, we firstly focus on improving patient outcomes. Then we look at how we can support clinicians to drive a more effective treatment regime. We support nurses and to get the best possible care that they can give in also an effective manner. And then we look at the cost of the total health system. So that's the impact that we drive with the application of technology. I think we are a technology company. We are very passionate about innovation, but we also know that ultimately it's about the impact it drives. So we always measure in outcomes for the broader health system.
And one more question from the audience. We have seen interoperability much better in the ICT industry. Anything we can learn from there? And from your view, who or which parties should be the main driving force to improve interoperability?
Yeah, I think interoperability is a wide question because depending on which customer or which hospital system you would go to, you would see a different set of systems you would need to interoperate with. So there is a role for integration. I think the biggest advancement we can make all is make sure that we don't develop proprietary systems, but we develop open systems. If you do that amongst the industry, amongst all providers, then actually you can get very fast to an interoperable model, especially also if it's cloud-based and supported. So that's something that we strive for, to open up all our applications. When you go back, we also had our own monitors that still had their own embedded software. Now we need to go to an open interoperable system where we can connect to all systems out there.
All right. Now we have a couple of minutes left, and we have this sort of game that we play at the conference, whereby I ask you, I just throw out a couple of terms out there, and then you just have to tell us what you think, whether it's overrated or underrated. So let's try a couple of them that I have in mind. So the first one is AI for drug discovery, underrated or overrated?
Underrated.
Amazon in healthcare.
Underrated.
And then global healthcare data exchanges.
Underrated.
All right. So you're very optimistic that all of these things have a bright future.
Yes.
I think we can wrap it here unless we have more questions from the audience. I'm just going to look very quickly. I think we have covered them all. So with that, I'm just going to close our conversation. Thank you very much, Roy Jacobs from Philips.
Thank you, Slavia, on this very exciting topic of telehealth. And I wish everybody a great conference.
Thank you.